Hello, my name is Beccari, and today I'll be presenting on global mental health care. First, I'm going to start off with explaining what exactly mental health care is and what a mental illness is. So, according to mentalhealth.gov, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life from childhood and adolescence through adulthood. It can be a biological or situational issue. Often that can be triggered by a traumatic experience. And mental health care consists of different treatments that are available to help cure or just sometimes maintain mental health disorders. Okay, now that we've established what mental health care is, now we can kind of talk about the mental health disorders that fall under that umbrella. Honestly, most of the time these disorders are kind of clumped together into one broad term of mental illness, but truth be told, they're all very different. First, we're going to start off with attention deficit hyperactivity disorder, which is often known as ADHD, a very common mental health disorder. Anxiety, which is another very common mental health disorder. Autism, which does fall under the umbrella of a mental health disorder. Bipolar disorder, borderline personality disorder, depression, eating disorders such as bulimia and anorexia, obsessive compulsive disorder, also known as OCD, post-traumatic stress disorder, also known as PTSD, which is very common among people who have been in accidents or military personnel who have experienced bad trauma, schizoaffective disorder, and schizophrenia. Now, depending on the type of disorder you have and the level of its severity, there's different treatment options that you can use in order to go about treating these disorders. Some of them include medication, psychotherapy, hospitalization, support groups, cognitive behavioral therapy, and dual diagnosis programs. Dual diagnosis programs are more common among people who have a drug dependency or an alcohol dependency that almost triggers their mental health disorder. So, for example, if you're an alcoholic, oftentimes you can suffer from anxiety when you're not drinking or not in an environment you feel safe in. So, that is a common kind of thing someone would have to deal with. And these dual diagnosis programs allow them to not only withdraw from the disorder they have of alcoholism or drug abuse, but also getting treatment for the pairing mental health disorder. So in order to look at the global view of mental health across the world, I'm going to start in the United States, which is home to most of us. So 1 in 5 adults have a mental health disorder in the United States. And where it is most common nowadays is in children and in youth and adolescents, especially in high school age. They often say the age of around 17 to 22 is the age where people who do have biological tendencies to have a mental health disorder end up having a breakdown and developing really what is going to be their disorder. The good news is that more insurance companies are covering treatments for mental health related disorders, but yet there's still a lack of access due to limited resources. And this limited resource comes from a deficit of mental health care workers. In states with the lowest workforce, there are up to 6 times the individuals to only 1 mental health care professional. And this includes psychiatrists, psychologists, social workers, counselors, and psychiatric nurses combined. So as you can see, there's a huge lack of resources for people who are sick, and often they get rejected from hospitals due to lack of beds, due to lack of resources, because there's just too many people seeking treatment at that time. Moving on to Europe, the major focus in Europe currently is deinstitutionalization. Now, when a person's institutionalized, that means they are in a psychiatric hospital, and often this is for long periods of time, which cause them to depend on the resources from the hospital rather than depend on their own skills and treatment and utilizing what they know to calm themselves down. So this is being replaced with more community health services, which provide a better quality of life experience for the patient. Additional doctors have become available and services have expanded in Europe, which makes access out of a hospital a lot easier. And their new policy focuses on mental health and deinstitutionalization, looks beyond the traditional psychiatric services to include a public mental health policy and an agenda for social inclusion. This policy of reform aims for an integrated and comprehensive approach, with treatment, promotion, and prevention equally important components. In Africa is kind of where we see the major mental health crisis going on. According to RAND, only 25% of the mentally ill have access to treatment, and this leaves a big portion of the mentally ill untreated in Africa, and this is especially prevalent in their low-income countries. Unfortunately, due to their lack of healthcare in general, a bigger priority is given to treat illnesses that are life-threatening. Not saying that mental health disorders aren't life-threatening, but they're not as immediate as something like HIV and malaria, which is very common in African countries. So little to no outside aid money goes toward mental health services. Another big issue with African countries is stigma. A lot of the communities and families have deep-rooted values and beliefs, so they don't necessarily want to seek mental health treatment. They kind of do at-home kind of self-care tactics, which sometimes isn't enough. And there's often a lot of shame associated and a lot of cultural beliefs that kind of go toward different non-traditional beliefs. Okay, now lastly, we're going to cover mental health care in Asia. As it's known, it's the largest out of all the continents, and it's also home to some of the countries with the highest suicide rates. For example, South Korea, Japan, they all have extremely high suicide rates, especially among men over there. And the normal route for treatment for mental health disorders is self-care tactics like family care and traditional health care to aid the patient. Additional mental health assistance is very scarce, and often it's only available in major cities, which limits the access to more rural communities. In conclusion, I can see that improvements are needed internationally to improve access to mental health care. The main issue I saw was the lack of mental health care professionals, so whether it be nurses, doctors, or just overall staff members to take care of these people, there's a seriously bad ratio of doctors to patients, and this is limiting, insurance companies can cover healthcare, but if there's no one there, people are going to be getting turned away. I also saw that stigma had a large effect, and efforts to educate the public on mental health disorders need to expand and continue. I know partly it started in the United States, but I think we need to take from Europe, who is deinstitutionalizing these patients and assimilating them into the community and showing that they are not these scary people, that these are disorders that everyday people live with and that they can succeed and do great things in life, and that overall they want to change the image of what a mentally ill person is. So that is the end of my presentation, and thank you very much for listening. Goodbye.